Welcome back, ladies and gentlemen. And yes, we are on to our final panel for the day at the Directors Event, South Africa's biggest board meeting. Now, let me tell you that the topic we're about to discuss is probably near and dear to every single person out there, whether you are a professional, whether you are young or old, black or white, male or female. We all care about the healthcare system because this pandemic has really stretched it. There's a lot of issues, of course, that may not be new to all of us. We are very aware of how the government has had to respond to this pandemic. But the big question is, what is it that we have learned from what has happened? And how is it that we can take this forward as, of course, we are now full onto the drive of trying to get as many South Africans vaccinated as possible. We still have a healthcare system that must take care of all the other health needs. And I can tell you that the panel I've got here are the biggest brains in the industry to help us understand what the real bottlenecks are, and more importantly, to reimagine the future. What are the actual opportunities for change? Where do the solutions actually lie? Let me introduce you to my panel. I do have Dr. Memela Makiwane. He is the chairperson for the Council for Medical Aid Schemes, for medical schemes rather. If you don't know what they actually do, they regulate pretty much all the medical schemes we've got in South Africa, and they make sure that you and I can interact with these schemes in a fair and transparent manner. We also have Dr. Angelique Kutsia, who is the chairperson of the South African Medical Association. What they do is they pretty much look after the professionals in the industry. They are not a registered non-profit organization, and they act as a trade union who takes care of the real professionals that take care of you and I. And then we've got Simon Hlungwane, who is the president for the Democratic Nursing Organization of South Africa, and they look after what I've been led to believe are probably the single most important group of healthcare professionals, and these are the nurses that are out there at our hospitals, private or public, and even in homes, looking after us as people who obviously fall ill, and of course who are dealing with this pandemic. And lastly, I have Dr. Nicholas Crisp. He is the Deputy Director General at the National Health, or rather at the National Department of Health, and he's responsible for, yes, you guessed it, the National Health Insurance. Big topic to be discussed today insofar as solutions are concerned. All right, we're going to go straight into it, ladies and gentlemen. Thank you again for joining me. Thank you again for making the time to be here live in studio. I'm going to start, maybe let me start on my far left there. You know, I was talking to Nicholas just before we got into the panel, ladies and gentlemen. Let me tell you, if you want to talk to somebody who's really experienced about our healthcare system in South Africa, straddling even two like governments, okay, is this gentleman, because he's probably seen it all. And Nicholas, let me start with you about what's on your mind, or rather what in your mind are the key issues facing the healthcare industry now, especially as, of course, we're dealing with this pandemic, the lessons we've learned in the past 2 years, and as we go for past few months, and as we go forward and figure out a way to roll out this vaccine and still have a healthcare system that can take care of everybody, including, of course, all the other ills that happen in society outside of COVID.
Yeah, thanks, Andile. So I think obviously there are many challenges, and our biggest challenge at the moment, immediate challenge, is to get on top of the COVID epidemic. We're not going to get rid of it in a hurry, so we're going to learn to live with it. But if we are able to control the way in which it spreads, and obviously I think everybody knows about wearing masks and social distancing and keeping sanitized, hands sanitized and so on, that's still the most important thing. We are busy with a vaccine rollout, which is very dependent on the availability of vaccines. So it's important that we get that running as fast as possible, as completely as possible. But what we mustn't lose sight of is that people still get ill from other things. And while we are now entering into the third phase of the epidemic, and we are seeing a lot of people being admitted to hospitals again, that means that there's less capacity in the health system. And that capacity I'm talking about, it's not just hospital beds, it's the staff. Our staff are very tired. They've been under attack and they've been extremely busy. They've seen all kinds of deaths and discomfort, and they've lost their colleagues and their friends during this time. I think we need to have a lot of understanding for what the health system is experiencing at the moment. But we have learned a lot. Perhaps the most important thing we need to learn is that we are one another's health keepers. If my health is your health, and it doesn't help that I'm healthy and you are not healthy. And we are seeing it with the international hoarding of vaccines, the failure to share the way in which the system's resources work, and the way that we are dependent on our ability to purchase healthcare rather than that we provide healthcare to people because they need the healthcare. And that's the basic tenet of universal health coverage and of our solution in national health insurance. We've learned a lot of small details. We've learned to work together with partners that have not really worked together in the past before, or who have struggled and been suspicious of one another. And that strengthens as we go. It's tense at times, which is understandable. We have different points of departure. But that has been a massive learning exercise. Sharing capacity, ideas, resources, people amongst private and public sector and between the provinces. We've also learned that if we don't have one comprehensive digital system where we can share the data, it's impossible to plan. You cannot control and manage an epidemic if you don't know whether the epidemic is moving, what the cases are doing, what the tests are doing, where we are registering and vaccinating people. And the systems that are needed to run that will be the systems that we need to really be able to run an integrated health service going forward. We also know that not only looking after our people, but looking after our medicines and our stock and having proper stock visibility and proper systems for purchasing, this has been brought to light very prominently with all the abuse and the fraud and corruption that has gone on. And there are lots of lessons, lest we ever try and do any of that again, of ways in which we should restructure our procurement and manage procurement going forward. So, I mean, there are many more, but I think just as some introductory comments, those are some of the immediate lessons.
Right. Well, let me move over to you, Mamela, from a medical schemes perspective. What to you, top of mind, are the biggest challenges and potentially some solutions?
All right. Many thanks, Andile. I thought Nicholas would not stop because he was basically covering everything. Andile, my biggest thing that I would like to zoom in is the management of the limited resources that we have in the healthcare system. That's all we need to do. We need to manage those resources better. I'm very glad that our political system is very ripe for that. Nicholas has just talked about the ripeness of the political environment in terms of the thinking about universal health coverage and the NHI and all that. That to me provides a ground for better management of the...
In resources, what would you put in
the
there?
resources.
What would be the primary ones?
Think about everything in resources. We must know that the healthcare is supposed to provide a merit good. It's not a commodity like we have always treated it in South Africa. Healthcare is a merit good which must be accessed per need. And I'm very happy that Nicholas has just laid the ground in that regard. Because what that means, Andile, is we have not sufficient resources. Nobody has sufficient resources. Even the first world countries do not have sufficient resources. But we just have to manage what we have better, do what needs to be done with our resources. We have heard many a time when health resources are mismanaged, used for if I may say, kickbacks in tender systems, for instance,
overpaying
for services that can be accessed at more affordable prices and all that. Resources basically talk about human resources, financial resources, stock, drugs, healthcare technology. Talk about any resource that you can think of in the healthcare system that can be utilized. We just need to manage those better. And should I need to talk to detail, I'm happy to do that.
Right.
For instance, one of the ways we can manage our resources better, also in line with the thinking with Nicholas, is to stop this fragmented approach to healthcare that we have.
What do you mean?
We have a fragmented healthcare system. Even at national department level, we have 9 provinces managing smaller budgets when we can put all those together. At medical aid systems. For instance, we have various administrators all managing small pools of resources that, if put together, those resources would manage to do far much more than we are able to do now. A small scheme that has got perhaps 10,000 beneficiaries, for instance, is unable to withstand a pandemic like COVID if this were to go on for a considerable amount of time. But putting the resources of all the different schemes together, we may have heard that medical schemes have got reserves of up to about 66 billion or something like that. But that 66 billion is not is not available to all the beneficiaries of the medical schemes. Scheme X has got a percentage of that.
Yes.
Scheme Y has got another percentage. So imagine putting all those together and move even further than that. Move out of medical schemes. Pool your medical schemes benefits, government or the 9 provinces benefits together. That's what we're talking about.
Okay.
And I think I'll pause there for introductory remarks.
Let's leave it there for now, Mamela. We'll come back to those limited resources. Angelique, let me come to you. South African Medical Association. What's your perspective? Where are the bottlenecks and what are the opportunities to even get better?
Oh, there's so many opportunities, Andile. We just need to identify them. We need to have the guts to change them. And we should, we always say it doesn't help us looking the other way. This is not going to solve our problems.
Yeah.
So for us currently, HR, human resources, is one of the biggest problems, and infrastructure. So human resources is not only unique to the public sector hospitals. We know there's a shortage of nurses. We know there's a shortage of doctors. We know that. And we know there's a moratorium placed on new appointments. So if we don't go and fix that, it's going to bite us, especially now with this third wave that we are seeing. Because as we have heard by Nicholas and Council of Medical Schemes, that the problem currently is not beds. Everyone is always asking us, do you have enough beds? Yes, we have enough beds. I'm quite sure about that. The question is, do we have enough doctors with experience? Do we have enough nursing staff with the correct experience to attend to those patients lying on those beds that are there?
But if we don't have enough, Angelique, then why the moratorium?
Don't ask me. We need to ask Treasury. We need to ask National Department of Health. We need to ask. There's a lot of people that we need to ask. But I also want to raise another concern that we from the Medical Association has been encountered, especially this last 2-3 weeks, is that doctors being employed by hospital groups. And we think that is wrong. Doctors should not be employed by hospital groups. A doctor needs to work independently and should not be part of a Life or a Medforum or a Medicare or whatever.
This is now the private sector.
That's in the private sector. So we only think about problems that's in the public sector. Don't forget, the private sector is there as well.
Yeah.
Don't forget that the nurses in the private sector is also not always correctly trained for ICU and high care. And by taking any nurse, just because she's a nurse, maybe she's a nurse working in theatre,
Yep.
and you take that nurse and put her into a high care ward or ICU, you put her up for failure, and you make it much worse. So the healthcare system on HR is a huge problem. We need to fix that. We need to work together. We need to break these silos between public and private sector.
Right.
We need to start to trust each other. There's a lot of distrust between the public sector and private and vice versa. We still have, in this day of age, that we refer patients to public sector hospitals and the doctor say, what does your GP knows? And actually cross with the patient for going for private healthcare, not understanding that that patient used some of his precious money to come and see us.
Absolutely.
We refer the patient back and the doctor just not seeing it. And vice versa. We don't always in the private sector trust what is happening in the public sector.
Yes.
We need to find each other halfway. If
Okay.
we're not going to do that, we're going to be in
You also
having
mentioned
problems.
infrastructure. Did you sort of weigh
Yeah.
in on that? What is the concern there?
Infrastructure, huge problem. We have seen now what happened at some of the hospitals in Gauteng, where there's a water crisis. We are from the opinion that if a hospital has got autonomy about its income and how they spend their monies regarding fixing a lift, fixing water problems, fixing a toilet, and not having to go through another department and wait for that for ages for that department. It should be the CEO of a hospital should have the powers and the accountability to do this and make sure his hospital is properly fixed. It's painted. There's toilet paper. The
Yeah.
toilets are
So you're saying
working.
the red tape is holding that back?
I think there's a lot of red tape holding it back.
Okay.
And then again, the hospitals, the public sector hospitals, needs to compete with each other regarding quality of outcomes. So if we know that hospital X or clinic X has got excellent outcomes and the patients are happy, patients will vote with their feet. So they will rather then go to that hospital or that clinic than the other public
Right.
sector clinic because it's give poor quality.
I see. Simon, you're representing the nurses. They've come up in almost everybody's comments. What are your thoughts?
Well, I think at the utmost, it's the human resource that
Yeah.
we have as a challenge, and I want to believe that it's more on the planning that we have in the country that is so poor. Currently, I think last year the World Health Organization released a report where they made an analysis and said, recommended in fact, to say all the developing countries need to be increasing the intake of doctors and nurses by 8 to 10%. But in South Africa, what happens is the reverse of that, is that I can give an example. The colleges in Gauteng training for nurses used to take around 300 per year. But starting from last year and even this year, their intake has reduced from 300 to 50. It tells you that they've reduced it, they're taking around less than 25% of what they used to take in the past. But when you look in the contrary, currently, when immunization or vaccination is happening currently in all areas where there are centers of vaccination, nurses that are doing the vaccination are being removed from their other core clinical areas, clinics and the hospitals. And what it has caused is that there is a lag in terms of the other services. Your immunization of children gets delayed, taking care of cancers and many other chronic illnesses. So what's going to happen is that the services that were supposed to be rendered is now neglected. And as a result, we might end up having far bigger problems in terms of chronic illnesses, people dying from heart attacks and so on because they are not taking their medication or being taken care of. So, but when I say the planning, I mean our thinking must then begin to say, what is it that we want as a country? We then develop short-term plans and long-term plans. Currently, as a country, we do not have plans to say how many trauma nurses do we want, how many ICU nurses do we want, how many, in terms of the population, nurse population ratios. We don't know how many nurses we want to train in the next 5 years. And it becomes a problem of planning. And it then supersedes every other thing that we do, because you just get told, I can give an example currently, a nurse will be trained for 4 years, whether you're doing a diploma or a degree,
Yep.
after which you go for a 1-year community service. So it means the government or whoever is investing is a 5 years investment. When they've done the community service, then they have to continue to work. In government, they get told they don't have money to employ them, which means you were investing in training this particular individual, but at the end of the training, you say you don't have money to employ. You didn't plan that this person will subsequently, after completion, service the community that he was working in. But when you're done doing that, then you ask yourself, who is servicing the communities that that nurse was taking care of in the year before? You find that in the clinics, the extra hand that was there is then taken away. So it simply goes back to say our planning is poorly and myopic. It doesn't look into the short-term and the longer-term planning. Because there's another study that was done it was published two weeks back in the Lancet Medical Journal. It indicates that employing more nurses and more doctors, in fact, the developing countries and any other country, it was done in Australia, but we have a similar context. We can save a lot of money by avoiding litigations. There's many other adverse events that you can avoid if you have adequate staffing. And I must tell you that right now, nurses, because they work long shifts, you work from 7 in the morning, so it's a 12-hour straight shift. They have a burnout because some of them are told you can't take leave because there's COVID. You must take care of the patients that are there. And obviously, for good reasons, nurses are called upon to stay in service. But when they are burned out, there isn't even emotional support. There isn't even adequate psychosocial support. You get burned out. Sometimes you get stressed by just seeing your colleague dying, your colleague getting COVID. And tomorrow you think, I'm going to be next. And you worry when you say goodbye to your children in the morning, you don't know whether you're going to come back. So there are those fundamental issues.
Yeah.
It's only because in the planning of the human resource,
Yeah.
you don't begin to say, how do you provide support services to the very same nurses that you have? And there's a lot of nurses who can realize that now that I don't have a cleaner in this particular environment, I have no choice but to take a mop and clean. But while I'm doing that, I'm neglecting to take another patient into the resource bay or and so on. So there's a fundamental problem when it comes to human resources.
And all of you from different walks of life are agreeing around this human resource issue. Let's just stay with it and now focus on solutions.
Okay.
Nicholas, it's obvious what needs to be done. What do we do?
So my view is that we need a revolution. This is not, you can't fiddle with the edges. Our health system is messed up and it's happened evolutionally rather than being properly planned. And there are many structural problems. And I mean, I'm on record of saying this. This crazy public-private split that we have where half of the total spending on healthcare is sitting in the private sector, who looks after 15% of the population, is not sustainable. And in order to feed the beast, you have to overservice, you have to do things that may not be the best for a patient, you have to do things in a certain way that consumes resources, especially human resources. So that's on the one side. Then on the other side, you have 85% of the population who has to be looked after with the remaining 50% of what we spend. This is the whole reason why we need the revolution. We need the massive reform where we use all those resources. 8.5% of our GDP is spent on healthcare. That's us as citizens. Forget about the government, forget about who's buying what or whatever. We spend 8.5% of our GDP. That's pretty good. For a middle-income country, that's good. And we are a very big economy, so in rand terms, that is a very big expenditure on healthcare.
Yeah.
We mustn't compare with those who have got 14, 15, 16, 17% of the biggest economies in the world being spent on GDP. We've got to focus on what we've got. The problem is when you're spending 4.5% of your GDP on 85% of your population. That's the challenge. And then the resources that are sitting inappropriately used, where we have specialists doing GPs work. We've got GPs doing nurses work. We've got nurses doing everybody else's work, the cleaners' work, as we've just heard from Simon. This is not appropriate. We need to have clear scope of practice, yes, but we do need to understand that that scope of practice of each of our professions is not so rigid that we can't help one another.
Right.
And we need to be able to, as Angelique said, use the 11,000 GPs that are in their practices who may not be fully utilized to be involved in the primary healthcare system. We need to be able to understand and care for those nurses who are currently running systems. Sometimes they run whole hospitals on their own. And I mean, that is just not right. It's not fair, and it's not fair on the patients.
Who leads the revolution, Nicholas?
So we are leading the revolution. That's exactly why the Department of Health, the government, and we are the ones who have tabled the bill to get a national health insurance so that we break these barriers. What the national health insurance will do is to create this pool that Mamela was talking about, bring all the resources together. It won't happen overnight. Nobody's naive enough to think you can just suddenly change everything. You'll break the system. But we do need to undo some of these structural problems. We need the fund. We need to capitalize that. People think it's new money. We're not talking about new money. We need to mobilize the money that is currently through the provincial equitable shares into the provinces, and we need to bring it into the pool so that the autonomy that we were hearing about just now, where the staff and the management of the hospitals have their own autonomy. It doesn't work like that now. Right now in the public service, the provincial administrations are the purchaser and the provider of care. The National Health Insurance model says somebody else will be the purchaser. You need to provide properly. But you're going to compete, as we heard just now, with private providers, other public providers, and so forth. And you need to up your game, you need to up your quality. But we will make it easier for you by pooling the resources, as Mamela said, and by pooling those resources, we can purchase at cheaper prices because we understand the volumes that are involved. We need the systems to be able to measure that. And we need generally to be able to do that long-term planning that Simon was talking about. The capability is there. In fact, the new organogram of the National Department of Health has created a whole separate branch just for human resources for health.
Right.
That's a major, major move in the right direction.
Gotcha.
But the health department will not do this all on their own. The whole HIV epidemic has been dumped on the health budget, and then the health budget gets cut. The whole epidemic of COVID is on the health budget, so you've got to scratch money out of the rest of the system. And we heard just now from Simon what it's doing to our nursing staff. Every department needs to help. Everybody. The social development department, the water department, everybody needs to be mobilized to make sure that a hospital has water, there's proper communication resources, proper fiber to the hospitals and the clinics and so forth. And if we pull together like that, the public and the private sector delivery mechanism will work together without any problem.
Let's stick with NHI. Coming to you, Mamela. I'm seeing in the media, though, like there's some friction seemingly between medical schemes and what the NHI bill is saying. I read somewhere something about the fact that the NHI's intention is that when it's fully implemented, that may negatively affect medical schemes. What is your view of the current NHI bill, and how is it working between collaboration between government's intentions and, let's call it, the interests of medical schemes?
Andile, you may hear about friction within the media and conflict. That is expected. Nicholas calls it a revolution. When a revolution is in place, not everybody will be in agreement. The reason why it's a revolution is that there's significant change that needs to be implemented. So there will be differences of opinions, thoughts, and all that. So Simon talked about the myopic views of different perspectives and all that. We need to move from the perspective of a provider, because once the provider changes, then I'm left wanting. Move from the perspective of a consumer, because now I pay for medical aid and I pay this amount of money, I must be entitled to superior service because my money is superior. Move from that perspective. We must adopt a societal perspective. Hence, we are all in agreement, because I'm saying that without fear of contradiction, because all the noises that we hear in the media, even the objections that you hear from different players and all that, none of those noises are actually vehemently opposed to the revolution or the move to universal health coverage via the NHI. None of them are opposed to it.
Right.
There is some disagreements in how to tweak this part or tweak that part, which are fine.
Yeah.
I mean, countries that have got a universal health coverage approach, for instance, take the United Kingdom. They established their NHI, or rather their universal health coverage, in 1948, soon after World War II ended, and their system had collapsed, perhaps even worse than what we are complaining about here in South Africa. Their health system had collapsed, but they implemented it in 1948, soon after the end of the World War, and it worked, and it still works now. Is it the same as it was when it was implemented in 1948? No, it has changed. So we also have a similar. We need to have a similar approach and know that we need to start. We'll implement. It will be tweaked from here and there, and it will morph with time until we make it work. We don't have to be perfect. So what is our stance as the Council for Medical Schemes with regards to the NHI? The Council for Medical Schemes is fully in support of the implementation of the reforms. As you know, the small steps that we are taking as the Council for Medical Schemes include, for instance, we are already starting consolidate the pool that we have control of within the medical aids scheme environment. For instance, there is amalgamations of smaller schemes, schemes that have got members of less than 6,000 or so are being encouraged to amalgamate, and that process is going on. Not very long ago, we had in excess of 140 schemes. Now we have 76 schemes under our regulation.
And how does this consolidation help?
The consolidation helps by amalgamating that pool we are talking about. The same as what Nicholas... Correct. It's the economists will be talking about efficiencies,
yes, economies of scale,
and stuff like that. So that is a no-brainer, because if the medical schemes environment could manage to reduce the number of schemes perhaps in a couple of years to a handful, the problems that we have now, the issues that we have, people complaining about their benefits being expended by July, for instance, yes, those may be a thing of the past. But of course, we don't want to end there. We want to migrate all these beneficiaries into the bigger pool of funds, yes, which is the revolution Nicholas is talking about. So we are doing that, amalgamations. Schemes that are government-related are encouraged to amalgamate. We are trying to reduce the number of options in medical scheme. You may think about any medical scheme. You probably have a medical aid andile, and you will know that at the beginning of the year they send you a confusing document, yes, that says choose an option, and you have like 15 options. You have no idea how this option differs, yeah, from that one, yeah, and what's the benefit of. Yeah. All you know is I'll pay so much here, and this one has got so much dental. What does that mean? You, yeah, have no idea, yeah, and no one can explain it to you. Yes. Not even myself, being a chairperson of the Council for Medical Scheme, can explain it to you. You see, so we need to move away from that, okay, pool our resources together, and try to manage the resources meant for healthcare just for that.
Okay. Angelique?
Just for that, yeah.
Are you joining the revolution? And if you did, what is most important to you?
I'm definitely joining the revolution. I can't toy, but I will join it. So for me and for Sama, if we can scrap everything and start over tomorrow, I think that would be the answer.
What do you mean by everything?
Just flatten everything and start all over again and build it correctly from the base. So we are still trying to fix it. And you know what? If you've got an old house and the foundation is not very good, you can try to paint that walls, and you can try to fix the leaks as much as you want. It's still going to have a problem. So, but we know we can't do that.
Right.
So what we would suggest, fire everyone that is not a medical or that sits in a position that has no idea what they are doing in that position.
Fire them.
Just fire. Let's get rid of them. Right. We can't fire them, actually, because they will take us to CCMA. So what we can do is, let's put them all in another political party. Let them go in there and let them stay there. And let us get people employed in positions who actually understand healthcare and who has come up through the ranks. It is no use to think that I'm a professor and I've run my department extremely well, therefore I can now become another role player in the management, just use Gauteng because I'm from Gauteng province, and now I can go to the Premier's office.
Yep.
You put me up for failure because I know my work, but I don't know the other part of it. So let's get people through ranks who knows and understand. Healthcare is a very, very particular, it's got a particular environment. You cannot ask someone who has been a teacher for many years, run his school, all of a sudden come into healthcare, wants to run a hospital or a clinic just because he was a good teacher. Yeah. Or maybe because I know him very well.
Yep.
And he's my best friend and I want him here.
Yep.
So we need to get rid of that. Then we need to look at all the policies, scrap the policies that's useless. Let's be honest and start over again, make it correct, Stop getting people from overseas in trying to tell us what to do. We are all sitting here. We have enough experience. We know the people. We've got unique communities in South Africa. I know my community. Simon knows his community. Mamela knows his community. Nicholas knows. We all know. Why do we need other people coming in, paying them a lot of money to tell us what to do? And in the end, we in any case need to do it over again. So let's just be open and frank and start over and get it right and work together. I need to be able to pick up the phone and phone Simon or Mamela or Nicholas and say, listen, there's a problem.
Right.
And he must not say, you know what, yesterday you slammed me in the media and now you want my help.
Yeah.
So I'm not going to give it to you.
Okay, so
We
that
should-
collaboration is important too.
We should have collaboration and we should listen. We understand what is happening in healthcare.
All right, Simon, you clearly have to lead the revolution because you are in the forefront of the human resources question. But what are the solutions, brother?
Well, like it was said here, the first question we need to ask ourselves is to say, given the pandemic of coronavirus, the COVID-19, how do you leverage this pandemic in designing a system that will be resilient in future? So we start with collaboration between private sector, public sector, all stakeholders, the medical aid schemes, the unions, and everybody. We make sure that we work together to make sure that in future, what we have is a system that is resilient to everything that might come in. Mind you, this may not be the last pandemic we experience in our lifetime. Absolutely. So we need to say, let's ensure that we realize universal health coverage. By flattening the curve, you ensure that all these partners must play a role together. And we begin to stop staying in our own cocoon corners and say, I want to watch how that person makes a mistake. But we need to collaborate further and make sure that we have a system that is fit for purpose, a system that is giving access to everybody. You need to stop having people in Venda, in some rural areas, who get diagnosed with cancer, or some die waiting for an appointment in Polokwane to go for certain diagnostic procedures. So we need to say, how do we increase that access for everybody? But it cannot happen if we are fighting on the vision, because it means we will not cooperate. We cooperate, will not collaborate, will not partner together. So the partnership becomes very important. We just need to lead a vision together and work together. That's where it will all start. But we also don't need people who are not fit for purpose in the positions, because they won't drive anything. Believe you me, if you put a person, whether it's in an administrative or a political position in health, who is not health trained or doesn't have a health background, they can spend 5 years trying to understand the concepts only, and they will deliver nothing. And that's the problem that we have in most provinces in our country. So we need fit for purpose leadership between the executive and administration. Once you get that flattened and understood clearly, then they can drive a vision, because they know what they're doing.
Fit for purpose leadership. We've got 3 minutes left. There's a hot topic on the agenda right now, and I want to hear all of your thoughts on it. Vaccination. Nicholas, go first. How far are we? How are we doing? Are you happy?
Yeah,
are we doing all the right things?
You should have asked me last. Yes,
Did you get vaccinated already?
Yes, I got vaccinated the day before yesterday, and I would encourage everybody. And I waited my turn. I waited for my SMS. I followed what was supposed to be done with the EVDS system, and I'm satisfied I got vaccinated. Thank you very much. And I would encourage everybody else to do that. The queue is currently over 2 million long, and we don't have enough vaccines to move it faster than we are moving it at the moment. But in terms of what we expect from a health professional, administrative, and organizational perspective, with the resources at our disposal, we are satisfied it's moving as fast as we can do it. If we get more vaccines, we can double the capacity. We've still got a huge resource amongst the GPs. The nurses are fantastic, the way that they smile and the reports that we get. 99% of people are extremely happy with the care that they've been getting. So I think we need to congratulate our colleagues on the ground. We need to thank them, and we need to support them. And be patient and wait, and you will be called for your vaccination.
Amela, I've got a medical aid scheme, you know. I thought I could get sorted quicker than most. Seems I have to join the queue and wait.
You know, Andile, what COVID has done for many things, including the acceleration of what you call technological advancement and all that, it has done the same for healthcare. You know, COVID has shown us that this dichotomy of public versus private is nonsense. It needs to end. Look at the seamless transfer of patients between private and public hospitals that has come out of COVID. Brilliant. Angelique talked about the difficulties that private practitioners may have referring patients to hospitals. That did not happen during COVID. We're talking about solidarity has been talked about, and everybody sings that song now. And we know that's as a result of COVID. Everybody has even punchlines like, you're not safe, or I'm not safe until we're all safe.
Yeah.
You know, that is exactly the view that we need to adopt. And the answer to that, only one. That revolution we've been talking about, and we are all in agreement about it.
We started the revolution at the directors' event. This day shall remain etched in history. Angelique, your thoughts?
I fully agree with all the previous speakers here today. We need to vaccinate our members or our people in this country as soon as possible, over 60 years old. I have heard how many people asking me, should I vaccinate? Yes, you should vaccinate. There is no contraindication. You will not grow a beard if you are a female, and if you are a man, you will not fall pregnant. And please, I'm begging them to please go and get onto the EVDS system. Ask your grandchildren to add you to the system. Go and vaccinate. We need it. We don't have enough resources to look after people in hospitals. And you don't want them in hospitals. You want them with mild disease outside of hospitals. And I would also want to plead to the GPs out there, please do not give a letter to your patient with a prescription and never touch him if he's COVID positive. He must come to your surgery. You must examine that patient. You need to walk the talk with that patient. As doctors, we need to be vaccinated. I'm vaccinated. I'm very happy. Whether it's working or not, I don't care. I haven't got sick. And I'm not using ivermectin and none of those things. So please go and get vaccinated. And GPs, examine your patients. Walk with them. Hold their hand with COVID-19.
Absolutely. Simon?
Well, vaccination is for public good. So everyone must be vaccinated. Obviously, those who are willing, those who don't believe in it, let them stay away from it. However, we must say,
at
their own risk, but vaccination is for a public good. If we are to rebuild our economy, if we need economic recovery, we need the health nation. So it means we must vaccinate everybody. We must make sure that at least this pandemic does not continue to hamstring our economy. So we need a healthy people to build a healthy economic recovery. That's why I'm saying everyone must be vaccinated if they are willing to.
Absolutely.
Thank you very much.
And Angelique has told you, you're not going to grow a beard, you're not going to fall pregnant. All the stuff you're reading about is not true, okay? Go ahead and vaccinate. Ladies and gentlemen, please join me in thanking my panel today. Mamela, Angelique, Simon, as well as Nicholas. They are all very well-experienced professionals in the field, sharing with us the challenges that are there in the industry. But today, on this very day, on the 11th of June, at the directors' event, we started the revolution of how do we get our healthcare system where it ought to be. Thank you very much.
Brilliant.
That brings us to the end of the 2021 Directors event, everybody. I hope you enjoyed it as much as I did. Thank you all for joining us today. Don't forget now that you need to complete the feedback survey. And once it lands on your inbox, make sure you give it the attention. And of course, that 1,000 Rand Take-A-Lot voucher is still available. And we'll let you know via email if you are the lucky winner. Thanks also to all of our speakers, all of our moderators, our wonderful panel members for all of your insightful contributions. Thank you also to BCX for the support that you've given us as headline partner, and also to the Institute of Directors in South Africa for the ongoing relationship. Ladies and gents, we continue to live in the pandemic. You heard it from the panel themselves. So please do not let your guard down. Continue to wash your hands and sanitize regularly, wear a mask, and maintain social distancing. And when your turn comes for the vaccine, Be there on time to make sure that you get vaccinated so that we can get this country to be on the right trajectory for growth. From me, Andile Kumalo, your host for the 2021 Directors Event, goodbye, salani kahle, totsiens.